Today we're going to talk about how to express your milk. The first thing to know is that the amount of milk that your baby can get at the breast is always more than the amount that you will ever be able to express with a pump. So it's very important not to ever express your milk to find out how much you have, because really that's just going to be very discouraging. When your baby's a newborn, you're going to have colostrum, which is going to come in a very small quantity, and it's going to be very nutritious for your baby. The best way for your baby to get the colostrum is to take your breast, obviously. But if your baby is unable to take your breast for any reason, maybe your baby needs to go to the neonatal unit for a little while, the best thing that you can do for your baby is to actually try and express your colostrum with your hand. So don't worry that your breast doesn't feel any different, because it won't for the first maybe 2 or 3 days after birth. So before we start expressing any colostrum, the first thing we need to do is we need to massage the breast. So we can use our knuckles and just go and try and sort of stimulate our breasts towards the nipple like this, and we can just give them a little bit of a massage. And then the other thing that's very important when we're expressing milk is that we want to think about and look at our baby. So if we're not able to be with our baby when we're expressing our milk, we could always look at a photograph of our baby, or we could smell some of our baby's clothes, and this is going to help the milk ejection reflex. So once we're going to, let's just pop my baby down there. There we are. So to express your colostrum, after you've done the massage, what you want to do is we want to put our hand about 2 fingers away from the nipple. So we want to put 1 finger this side, and we want to put our thumb about 2 fingers from the nipple the other side. When you're expressing your milk and pressing around the areola like this, opening and closing your fingers like some pliers, you might want to change the position of your hand on the breast, and you'll find out by practicing which position is easiest for you and which milk glands actually give more milk. Now, when we do this, we mustn't get discouraged, because the milk or the colostrum won't flow straight away. It could take 30 to 45 seconds for the milk to start flowing. So don't just give it 1 squeeze and then think you don't have any milk, because that's just not true. You've just got to keep going. So once we get a few drops of colostrum, then what we're going to do, we can either take maybe a little spoon, and we could feed our baby with the spoon, or what we could do is we could use a little medicine pot, and we can get those at the hospital. And we're going to express our colostrum into this little cup, and every little drop of colostrum that we get from the breast, we're going to give to our baby. And it's actually much better to feed our baby with either a spoon or a cup for the first couple of days, rather than giving the baby a bottle, because this is going to avoid confusion between the bottle and the breast. So if we're going to feed our baby with the cup, we want to sit our baby up gently. We want to just place the goblet, which will be just half full, up to the baby's mouth, and we're just going to gently tilt the cup until the colostrum touches the baby's lips. We're not going to pour it down the baby. We want the baby to lap it up like a little kitten. And hopefully we won't be needing to use the goblet for too much longer, because the best place we want the baby to feed from is the breast. So if you need to express your milk from time to time because you're going back to school or you're going back to work, then a manual pump may be a good option. It's pretty inexpensive and it can work very well. So before we're using any pump, the first things we need to do, we need to massage the breast, we need to be thinking about the baby again. And the other thing that we really need to make sure about is that the flange of the pump has the right size for your nipple. You can see that this really makes a huge difference. And if your nipple is too large and it's going into a very small flange, you're not going to get very much milk and you're going to damage the nipple. So it's very important to have the right size for you. And when we're using the pump, we want to try and mimic the baby's sucking. So when we put the breast pump on the breast after we've massaged, we want to try and do the action nice and quickly, as if it would be the baby sucking very quickly to get the milk ejection reflex. Now, when the milk starts flowing, then we're going to make the suction slower and more rhythmical. And that's going to help the milk to flow nicely. If you need to pump on a regular basis, you may find that an electric pump might be better. It is quite a lot more expensive, but it is actually more efficient as well. If you do need to be separated from your baby, either because your baby's born preterm or your baby needs an operation, you may find it better to either rent or borrow a double electric hospital grade pump, because this is going to keep your milk supply well established. So if you do need a double electric pump, you can always call 211, or you could actually ask your local pharmacy or your CLSC and see if you can borrow one for a lower price. For storing your expressed breast milk, you can store it in some bags, and you can store it in the refrigerator for up to 8 days. And actually you can freeze your breast milk for up to 6 months and 12 months in a chest freezer. Once you've actually defrosted your milk, it will only keep for 24 hours in the refrigerator. Now, the best way to heat up any expressed breast milk is to actually heat it up in a jug of warm water. We should never use the microwave for heating up breast milk, as this can be very dangerous and cause the baby to have some burns in the mouth. The other thing that you might want to note is sometimes when we defrost our breast milk, it does change a little bit the odor of the milk. It may smell a little bit metallic, but don't worry, your breast milk is still really good for your baby. So have fun. If you express some more milk, you can always keep it for another day. So remember, when you're expressing your milk, it's really important to think about your baby and to imagine your milk flowing. Because remember, we have lots of love for our baby and we don't really have any love for the pump.